Lecture 3 in the Practice of Cardiac Sonography 4 unit is Professional Practice and Development. The contents of the lecture are 1. Interprofessional dimensions of echocardiographic practice, and 2. Professional Development Action Plan. Learning outcomes. Following the lecture, you will be able to 1. Express how to discern ethical ways of relating with others in a professional environment, and 2. Formulate an action plan for continuing professional development. Material from this lecture is drawn from the Code of Conduct document from the Australian Sonographers Association, and secondly, from the Continuing Professional Development in Health and Social Care textbook. Both of these are available via Views. Part 1. Dimensions of echocardiographic practice. Firstly, a review of relating with patients. We've previously discussed some of these aspects of dealing with patients, but it's important to remain familiar with them, and so the first part will involve a brief review. Respect. Regardless of the patient's race or religion or disease, etc., every patient we deal with deserves our respect. Understanding. Sonographers are often involved in caring for patients with disabilities. We also deal with patients who are under considerable duress related to their disability or to their illness or other factors. Each one of these patients needs our understanding. Consideration for each person's modesty, female or male, young or old, is also essential. Being ill is never easy, indicating that you are aware of this, that you empathize, will help patients considerably. As patients are often uncertain about the environment and or about the tests they are having and or about the outcome, providing them with reassurance is also helpful. And of course, it's also important to be very patient, especially with those who are frail and with those for whom mobility is a challenge. Some other important matters. Preparation. Don't commence a study unless you are clear about the indication and know as well as possible the patient's history. Ensuring that you wash your hands before and after each study and clean the transducer and wipe the ECG electrodes are some of the most simple but effective ways of preventing the spread of disease. And diligence in regards to arranging regular maintenance of equipment is also important. Some new material which is an extension of these professional considerations. Ethical and just behaviour. A professional activity needs to be conducted according to certain standards. Ethics is the branch of knowledge that provides principles to help us ensure that our conduct is right. Moreover, there are laws that help to ensure that specific professional boundaries are maintained and that the rights of patients and health professionals are protected. Ethical behaviour. Most of the time, we approach our work and deal with patients in a manner that is clearly acceptable. However, occasions will arise when it is either uncertain or we may be inclined to behave in a manner that's not right. The principle of beneficence is a sound ethical principle to follow at such times. Simply stated, it is, do to others what you would have them do to you. For example, ensuring that a patient is comfortable and that his or her privacy is respected to the degree you would hope for will help you ensure you behave professionally. Moreover, aiming to approach your work with a degree of honesty that you would expect others to show you is another way to ensure good professional behaviour. The principle of non-maleficence is another sound ethical principle that may also help when you're uncertain. Simply stated, it is, do not do to others what you wouldn't have them do to you. For example, you would not want someone to perform your echocardiogram in a careless manner, paying little or no attention to you or to the technical aspects of the study, nor would you want someone to deliberately undermine or harm you, or to be dishonest to you. Justice. Every human person, by virtue of their life, has inherent rights which need to be respected and protected. Examples of rights we all have include the right to life, to freedom, and to own property. As such, actions that endanger someone's life, or threaten their freedom, or deprive them of what is rightly theirs, need to be avoided, personally and collectively. There are limits to freedom. Freedom doesn't mean a license to do anything we want. That is, with freedom comes responsibility. Professionally, when we accept employment, we commit to a particular role with tasks and hours as indicated. Employees also commit to limiting within reason personal matters during their time at work. Employers have responsibilities too. They commit, for example, to regular payment and to other financial incentives. They need to ensure that the workplace is conducive to quality work and safe work, as well as treating employees with respect and understanding. A professional development action plan. Continuing professional development. An experience that is common to most people is the sense that the more you learn, the more you realize how much more you have to learn. Advances in all academic fields means that today the need for continuing professional education and learning is as important as ever. As such, the readiness to acquire new professional knowledge and skills is essential, along with an understanding that learning is a lifelong process. If you do so, you'll be sure to grow in knowledge, skills, and competence. Approaching learning in this way will help to transform your career, enabling you to develop and to advance. Of course, this will not only help you professionally, it will also help you in a valuable way to contribute to the support of your family and the society at large. Career paths differ from person to person, even within the same profession. One universally important skill that needs to be developed so as to advance professionally is the formation of good judgment. That is, learning to recognize your own abilities and limitations, and learning when it's best to proceed with a task or better to ask for help. This takes time to develop, although it can be aided by making the most of any support via supervision and or mentoring and regular performance review. Some other key attributes. Knowing how you best learn and develop skills is very helpful. That is, your best learning style may be kinesthetic, hands-on. It may be visual, reading and seeing, may be auditory, talking and listening, or it might be a combination of styles that works best for you. Keeping up to date with advances in how material is presented and how to access electronic information helps. Membership of professional associations will help ensure you keep up to date with developments within the profession, as do regular formal and informal meetings with your peers. And reflecting on one's own performance is of course a valuable way to improve. Examples of this kind of practice include keeping a diary and contributing to a database of case studies for review. The transferal of knowledge is another important means of professional development. Accepting roles with more responsibility enable you to transfer knowledge and inspire you to improve your own performance. Teaching is of course an excellent way to transfer your knowledge. It also helps you to ensure that you reflect on your own performance and remain up to date with advances within the profession. Professional regulation. Regulations help to protect patients, clients, employees and employers. They promote the development of standards which provide frameworks that are often very good points of reference. Regulation also helps to promote the awareness of advances within a profession and promote the development of professional contacts. Examples of some of the sonography associations that help to develop regulations include the Australian Sonographers Accreditation Registry, the Australasian Sonography Association, and the Cardiac Society of Australia and New Zealand. A portfolio. A portfolio is a composite picture of your achievements. It's a collection of certificates, reports, academic transcripts, references, awards, etc., which should include both professional and non-professional matters, as well as your CV. A curriculum vitae is an important part of your portfolio. When looking to develop your CV, it's important to think carefully about its format. It should not be complicated. It needs to be readable, presented in a simple and logical way. And having both short and long versions may prove helpful. Some elements of a CV may include personal details, a brief executive summary, educational achievements with the name of degree and institution, memberships, employment experience with dates, responsibilities such as managerial and teaching responsibilities, awards and skills like languages or sporting or artistic achievements, and other elements, especially those related to social and community service. In conclusion, in part 1 of the lecture, we considered interprofessional dimensions of echocardiographic practice, with the aim of helping you to learn how to express and discern ethical ways of relating with others in a professional environment. In the second part, we considered a professional development action plan with the aim of helping you to formulate an action plan for continuing professional development.